My name is Diana Machi and I'm a clinical psychologist by profession. My work generally involves working with people who have various mental disorders, and I work with them through the journey of understanding themselves and finding solutions for themselves for their problems.
Hi, my name is Zipporah Wanjiku. I am a mental and emotional health advocate. I basically just campaign to raise awareness on mental and emotional wellness, and in partnership with such professionals, I also try to understand better mental illnesses and share information and link people to the right professionals so they can get the medical care that they require. I speak at schools, churches, wherever you need me to come to talk, I will come. I share my personal experience with depression and suicidal ideation in a bid to just help others feel like they're not alone and you can get through this.
We will start our conversation by discussing and just generally give information about mental health. When we talk about mental health, most people understand mental health to be, someone who has psychosis, because we go to explanation of, someone who's crazy. But generally, when we discuss about mental health, it's just one's understanding or one's perspective of their emotional state, which has to do with people's feelings, their cognitive state, which has to do with their thought process, and generally their behaviors and actions that can influence or have impact on their personal lives or the lives of people who they are close with. So when you talk about mental health, there are many causes of poor mental health. There's the good mental health that is associated with positive feelings, and then there's the poor mental health associated with negative feelings, some of the causes could be negative childhood experiences that one has had, bullying in school, lack of employment opportunities, or lack of finances, or economic situations that are not very good. We also get negative mental state can also be caused by gender-based violence, which affects both men and women, and also loneliness, especially during this COVID period, where because they have certain people, because of the need to isolate and not infect other people, have to be by themselves. So that can also have an impact on one's mental health. And also stigma and discrimination at the workplace, or based on one's gender, one's culture, or one's faith. So those are the common causes of poor mental health.
Okay, so I would like to ask, because there's conversations around mental wellness or mental health and emotional health. How would you say the two tie together?
As I said earlier, mental health, one of the components of mental health is the emotional health. So it's when we discuss about mental health, some of the components will be the emotional state of a person. There are several components to that. As I was saying earlier, it could be emotional, it could be cognitive, it could be behavioral. Other people also include spiritual well-being as being one of the components of mental health. It could be also the physical aspects. It could be also the environment that one is in. Yeah, is it a positive environment where you're able, where there's positive energy, or is it where you're always associating yourself with toxic people, or generally the physical environment itself could be negative. Also, one's vocation or one's calling or one's job or employment can also be one of the components of mental health. Is how do we associate when you're with your colleagues? How do you relate to your employer, for example? That can have an impact on your mental health.
So as you'd said, one of the common misconceptions with mental illnesses or mental health is the concept of being crazy. While in the last 3 years, as we were talking earlier, you mentioned that there's been an uptake in reception towards embracing going to therapists or seeing doctors for different kind of mental illnesses. But let's define or break down what mental illnesses are. is depression a mental illness, or depressed versus depression, things like that? Could you help us understand that better?
So when me as a psychologist, when we discuss about mental illness, my reference point will be what we call the DSM-5. That is the current edition of our mental health book. It's like our Bible. So DSM-5, DSM stands for Diagnostic Statistical Manual. The current edition came out a couple of years ago, and this DSM-5 has different categories of various mental illnesses. For example, there's the mood disorder, there's the anxiety disorder, there's personality disorder, there's developmental issues that has to do with children. So it's a whole list of different types of disorders that affect people. But when, in our common understanding, when you talk to anyone on the streets, for example, when they say when we talk about mental illnesses, there's the common ones that we talk about. When it comes to mood disorders, there's the depression and bipolar. That is very common. That seems to affect certain percentage, higher percentage of the population than others, for example, to do with autism, that is a developmental disorder, or personality disorder such as narcissistic personality disorder. So the other common a group of mental illness that is very common is the anxiety disorders. So this under that category, there's PTSD, there's anxiety disorder, there's general OCD, obsessive compulsive disorder, PTSD, which stands for post-traumatic stress disorder, and generalized anxiety disorder, and panic attacks, which affects people.
I'd like to understand a bit better. I was told this, and I would like you to correct me. There's being depressed, and then there's being in depression. As we handle the mood disorders first, which are most prevalent, what would you say, is it actually a distinction? Is it actually a difference, or is it the same thing? Or is it just terminologies, or what is it?
Being depressed and being in depression?
Yes. I was told that, or rather someone explained to me that you could be depressed in that you're just sad for maybe a week, a couple of days, but then being in depression is diagnosed by a clinical psychologist. It's probably past 2 weeks or 3 weeks. There's a significant difference, but I'm not too sure how accurate that is.
There's what we call acute mood disorder, yeah? So acute mood disorder is, there's, first of all, when we look at mood disorder, what do we understand by mood disorder? What aspect of our life does it affect? Mostly it has to do with loss of pleasure in things that we used to find enjoyable, or things that were interesting to us do not interest us anymore. Or the other thing is the negative emotions that we feel, yeah, when we are going through life, yeah. So when as a psychologist, or as a psychiatrist, when you're doing a diagnosis, or when you're giving diagnosis of for example, depression or acute mood disorder, which is also depression, you must exhibit as a patient certain symptoms for certain duration of time. For example, people who have diagnosis of acute mood disorder must have certain criteria, certain symptoms for at least 2 weeks, yeah, continuously. So when we discuss about this, when we talk about these symptoms, what are they? So symptoms of depression include loss of interest in things that we used to enjoy in the past, changes in our sleep patterns, so we sleep a lot or we don't sleep much, changes in our eating pattern. Some people tend to eat a lot, or others experience loss of appetite, lack of concentration, or not being able to concentrate on what one does, and general feeling of sadness. There's the general feeling of not being involved in anything, so what we call psychomotor retardation, yeah. You generally become slow in activities that you normally take part in, yeah. The other extreme of a mood disorder, one of the symptoms that is extreme is suicidal ideation or suicidal thoughts, and actually people who won't have the feeling of wanting to commit suicide or actually do commit suicide. So those are the symptoms. So when you're making a diagnosis as a psychologist or as a psychiatrist, so those are the things, those are the questions you'll be asking your patient. How are you feeling? How do you sleep well at night? What is your eating pattern? Do you participate in activities? Or some people just withdraw. Yeah, they become isolated from their family members and from their friends. And unfortunately, our cultural understanding of some of these things, some of these symptoms, because we are not aware or very accurate in doing diagnosis, we say, okay, that person is just being lazy, not recognizing the fact that there are other issues that this person is dealing with. So those are the symptoms, those are the presenting symptoms of someone who has acute mood disorder. At least they must be experiencing those symptoms for at least two weeks. And then there's the other bit where you are generally not receptive. You do not experience acute negative emotions, but there's the presence of negative emotions for a very long period of time, at least 2 years. That's where we give the diagnosis of dysthymia, which is a mood disorder. So you must experience some, depends on the severity of these symptoms. How severe are they? Most of the time, dysthymia, when it comes to the symptoms, they're not very severe. But in terms of duration, it takes at least 2 years for a psychologist to give that diagnosis. But in treatment, we'll get to discuss about treatment. It's not about, giving a diagnosis to a patient, which is most important, but understanding their symptoms and walking through with them through the journey of getting healing.
Mm-hmm. And those symptoms, as you've said, for acute mood disorders, does that cut across the others within that grouping, or it's just specific to depression? It's specific to depression.
That is specific to depression. And general mood disorder, so those are the things, when we talk about mood, it's about our feelings, and our not our reactions, our feelings and our thought process. So when we talk about anxiety disorders is when we talk about our reactions, because, for example, when you talk about PTSD, post-traumatic stress disorder, is when a person experiences certain symptoms based on a specific event. For example, death of a loved one, or an accident, unexpected severe accident. For example, you were head-on collision with a truck, or some people experience war. For example, refugees, there's high number of cases of PTSD in people who've experienced war, or even terrorist attack. Not recently, but some time back, when we experienced the Dusit attack or the Westgate attack, some people experienced PTSD based on that specific event. So it's an event-triggered reaction. So people will have nightmares, they're not able to sleep well, they have recurrent thoughts of that event happening again. You may experience subtle response. So this happens when a person, because of the past negative past experience that they've had, anything, for example, even a loud bang or anything loud seems to trigger negative emotions in them. So because it's a defense mechanism, they feel like they need to run away, and there's that need of feeling like they need to protect themselves. It happens very often to people who experience PTSD. One of the anxiety disorders also is what we call panic attack, which is also very, very, very common. This happens suddenly. Most of the time, we don't even realize that we are experiencing it. And this, you start feeling, because of the negative fear or the fear that you have in you, that sudden fear out of nowhere, you start feeling physical symptoms. You start sweating, your hands start shaking, you feel confused, You feel some heart palpitations, your heart is beating very fast. So you feel like somewhat you're between two worlds, you know, you're present, but you're actually not present fully. So this happens often to some people. I will not say very often, but some people may experience that anxiety disorder.
So under the first one, mood disorders, depression is a bit more common in our society, but bipolar is like that little friend that we're not too sure how to identify. So what would be the signs and symptoms within that context?
So for people who experience bipolar, bi means two, and we understand the polar, right? I think that's the easiest explanation. There's the South Pole and the North Pole. Same goes with the symptoms. You experience very positive, or rather, let me not call them positive, rather very high emotions, and then negative emotions after a period of time. So what happens, when you're in that high state, you're very happy, you're very friendly with everyone is your friend, you're spending so much money on things that are not necessary, you become reckless, you know, there's that highness of positive feelings, you have so much energy, and then a few days later, you become depressed. So you start feeling that you're sad, you feel hopeless, you do not want to associate with people, you want to isolate yourself, you're mostly by yourself. So that's why we call it bipolar. There's the high of the positive feelings and the low of the negative feelings, which is extreme. So it's a combination of extreme emotions, positive emotions and negative emotions. So that's why it's also called bipolar disorder.
Well, that triggers a misconception, because I've heard, and I think I've personally been one of them, thought that bipolar meant the split personalities. When someone 1 minute is Jennifer and then the next they're Mary, or 1 minute they're having this kind of situation, reaction, emotion or state, and then in a split second or maybe in a span of hours, they flipped to a whole completely different person. What is that exactly?
That is what we call multiple personality disorder. And there's a whole field of discussion and research to do with multiple personality disorder and why it happens. As you're saying, it's like switching between personalities, maybe as a way of, it's a protective mechanism. Maybe Jennifer has a strong personality that you want to identify with, but then because of the maybe negative experiences that you've experienced, you have Mary, who's more withdrawn, who's more protective of herself, who's experiencing, you know, all these symptoms of crying, you know, it's what we call split personality, or sometimes multiple personality, because it has to do with more than one personality, where you have different identities, yeah? But there's one person, but they have different identities of themselves, or they identify themselves with more than one person at the same time. But bipolar is about mood, yeah? Is about experiencing positive emotions, sometimes experiencing negative emotions. So that's the difference. Bipolar has to do with mood, and multiple personality disorder has to do with the persona or the identity that one gives themselves.
How about schizophrenia?
Schizophrenia has to do with experiencing, we look at our senses, hallucinations, for example. People who have schizophrenia hear voices, yeah? People have schizophrenia, sometimes that's why you hear voices, and they're drawn to wanting to commit suicide, or, you know, you hear voices telling you to do certain things. There are people who have tactile issues, so you feel like something is crawling on you, so you wake up in the middle of the night, you're scratching yourself so much because like you feel like something is moving on you. So what we call the hallucinations has to do, that's what we call auditory hallucinations, because of the hearing voices. Sometimes has to do with one's feelings. So it's very extreme mood disorder. But then there's also certain withdrawal symptoms associated with some of these symptoms. For example, hearing voices or wanting to scratch themselves, yeah. people who have various addiction, maybe to cocaine or to heroin. That's a whole different discussion. So they, because of the withdrawal symptoms, they also experience some of these symptoms that we're talking about. Yeah. Yeah, so there's schizophrenia, there's bipolar, there's depression, but under mood disorder. But these are not, for example, schizophrenia is not very common. It's there, but it's not as common as depression or bipolar.